Okay, can you tell me your first name, please?
I'm Jackie.
Okay, and how long have you been a patient with the practice?
4 years.
4 years. And can you tell us a little bit about your cancer experience?
Yeah, originally I went to a different doctor, but as one of Jehovah's Witnesses, he wasn't going to go very aggressively with my non-Hodgkin's lymphoma. And because of that, I didn't like the sound of "we'll control the cancer." And we got in contact with Dr. Fada through Sue Grant, who used to work at Crittenden. And she got us an appointment. He did some tests the other doctor didn't do. I felt real comfortable with him, and he was so kind. And as a matter of fact, when he told me with this aggressive chemo that I'd lose my hair, I think that's probably one of the first times I broke down, and because I was pretty stoic through the whole thing, I think, and I felt stupid that I would cry, over losing my hair. But then, because that's not only are you sick, but you look sick, and that was hard as a woman. But once I got used to that idea, and I trusted him, and I wanted to beat this thing, I started treatment right away. Only lost between my 2 consults a few days, like 3, and over the holidays besides, which is amazing. So,
can you tell me a little bit more about the Bloodless program and how that applies to you?
Yes, with non-Hodgkin's lymphoma, when they go aggressively, a lot of times your numbers go down, your white cell count, your red cell count, and what a lot of doctors will do is just give people blood. Well, because of my religious stand. Also, on a personal note, I don't like the idea of getting blood because there's dangers with that. He actually embraces where you can get injections, boost your red cells, boost your white cells, and your body then can do its own job and make its own blood. And I felt well for the most part, after 3 rounds of chemo that were 3 weeks apart. It was aggressive chemo, but if I had any, problems like any neuropathy in my hands or my feet, Dr. Fada would adjust my chemo to that. If you had a reaction to anything, they made sure that you were kind of aware of what might be a reaction, and then they would go more slowly in the infusion process of the chemo. And the anti-nausea drugs were wonderful. I had a good appetite through the whole thing, which helped me tremendously. So I didn't lose a lot of weight, because a lot of times that's one of the things that's really hard on people too, is if you're not getting nutrition during chemo, that adds problems too. So.
Okay, great. Can you tell me then any more comments about your care and treatment that you received at the practice? Any anecdotal stories about Dr. Fada or the nurses?
Dr. Fada he's just wonderful. He would always greet me with a hug and a smile, and that's always encouraging. And the staff always smiled, and that was great too, because you need that reassurance. And got friendly with so many of them, and of course, there are people who would come and go, from the practice, different nurses and everything. But you got to know them, and we really liked them, and they always listened, and they were warm. They had blankets for us because a lot of times we would get cold, and offered us things to drink, and they had room for anybody that came with us, because usually I had somebody who would drive me. And of course, the chemo process, it was like maybe 5 hours. And, my friends and family would sit for 5 hours with me. Even sometimes I'd be sleeping, but they were there. And also, there was a camaraderie between a lot of the patients. The patients would talk to each other, and we would share our experiences. And it was helpful, because you were talking to somebody who knew exactly what you were going through too, And there were different, chemos for different kinds of cancer, even with the same kind of cancer, depending on who the person was. So, you realize you were getting individualized care, and that was good too.